next we're gonna go ahead and do the LNSPT here. Normally I have the period charting open on my computer, and I would have the laser instruments all set up here. But for demonstrating purposes, we're gonna go ahead and pretend that this is the tip of the laser. So basically for the LNSPT, what you want to do is stay in the sulcus for 10 to 15 seconds, and we usually do a horizontal sweep, a vertical sweep, making sure that all the root surfaces of the tooth is covered. That way we can achieve a good surface of bacteria, so there's no more bacteria basically. So then we'll go ahead and normally we would have our HVE suction on our left hand to keep the tooth cool, or the teeth cool. But we're gonna go ahead and just go ahead and demonstrate it for you here. We'll go ahead and start with 1 millimeter, and then basically we'll go ahead and, so just like the bleeding stroke, we're gonna go ahead and go horizontal first, and then we'll go ahead and walk it vertically to make sure that all the tooth surfaces are covered here on the upper right of number 2. So just like that, and then we'll go ahead and do vertical motion again, and then we'll go ahead and go to number 3. So vertical motion and then horizontal sweep here, making sure that each area of that root is covered. Of course you want to go into proximally also. Then we'll go to number 4 here, vertically and then horizontally sweep. So basically you want to be in the tooth for at least a minute, making sure that all the surfaces are covered. But for demonstrating purposes here, I'm not gonna do the 1 minute portion, so we'll go ahead and do the lower left here vertically, and then horizontally here we'll do the sweeping motion, getting all into proximal, and then do this vertical again, and then we'll go up to this tooth, vertical, getting all into proximal, and then horizontally removing it here. And then number 20 and number 21, and then we'll do this horizontal sweeping motion here. Alright, so basically, like I said, a minute, 10 to 15 seconds each. You want to make sure that the root surfaces are covered, and we'll be able to make that root surface almost bacteria free, so we can get that healing going. So that's basically the LNSPT portion. So after you do the LNSPT, what you want to tell your patient for post-op instructions are tell them that their gums might be sore for the next few days. They can rinse with warm salt water rinse 2 to 3 times a day for about a minute each time. They want to be avoiding crunchy, sticky, or chewy food for the next couple of days also. If they do smoke, try to avoid smoking in between that time. But for pain management, what you want to do is, you want to tell them to use acetaminophen, which is Tylenol, so they don't bleed, because if you tell them to use aspirin, they would bleed afterwards. Other than that, that's your post-op instructions for LNSPT.